The process of experiencing respiratory impairment from submersion or immersion in a liquid is called as drowning. It is a form of asphyxia. It is also the second most common cause of accidental death among children between the age group of 1 to 4 years. What are the reasons that lead to drowning? Drowning may occur because of exhaustion or panicking while you are in water, or because of losing support such as life vest, or because of becoming hypothermic while in water, or losing control or being swept into deep waters, or mainly because of intake of alcohol or drugs while swimming. Types of drowning. There are 4 types of drowning: immersion syndrome, secondary or near drowning, wet drowning, dry drowning. Secondary drowning refers to a submerged victim who has been rescued and who survives for almost about 24 hours. Death in such victims occur by cerebral anoxia or by irreversible brain damage, whereas in immersion syndrome, death occurs by cardiac arrest caused by vagal inhibition. Pathophysiology of dry drowning. When drowning occurs, the victim starts to panic and attempts to hold his or her breath, due to which the victim starts to swallow water. The swallowed water is either being vomited or aspirated, which leads to laryngospasm, followed by seizures, hypoxia, and ultimately death. Pathophysiology of wet drowning. The child becomes unconscious before laryngospasm. In return, the laryngospasm causes hypoxia, which causes loss of airway reflexes and aspiration of large amounts of water. This is basically known as wet drowning. But due to wet drowning, the hypoxia level increases as well as acidosis increases, which would result in cardiopulmonary arrest. Therapeutic management. It is of 2 phases: pre-hospital management and hospital management. In pre-hospital management, rescue the victim, initiate CPR, make sure that the victim requires adequate oxygen, and most importantly, elevate their head up to 30 degrees, which may help them to lower the intracranial pressure. Also beware that many casualties who drown may bring up stomach contents, so be prepared to roll them onto their side to clear their airway. If the casualty shows signs of becoming responsive such as coughing or opening eyes or speaking, also if they start to breathe normally, just put them back to their normal position. You may also need to treat hypothermia. So to do so, you have to cover them with warm clothes or blankets. If possible, replace the wet clothes with dry clothes. Monitor the casualty level of response and prepare to give CPR again if necessary. In case if you have used a defibrillator or AED, leave it attached. In hospital management, the fluid and electrolyte balance is made sure that it is on correct levels. Also, there is a routine check of cardiorespiratory, blood gas levels, and hypothermia is also initiated. Prevention. Never leave children unsupervised near any water body. Adults should be trained in CPR so that they can rescue anyone if necessary. Life vest and rescue equipment must be kept handy.